now we're going to be moving to our next speaker, Dr. Ahmed Soliman. Hello, Dr. Soliman. Thank you for joining us.
Hello. Let me see if I could quickly share my screen here.
Sure. In the meantime, I'll just give a short intro. And so Dr. Ahmed Soliman's parents are Egyptians that immigrated to the US. Dr. Soliman grew up mostly in Houston, but lived intermittently for a few years in Denver and in Alexandria, Egypt. Dr. Soliman attended medical school in Alexandria. After graduating, he worked at Duke University with basic science research, then subsequently started his IM residency at the University of Texas Houston program. After graduating, Dr. Soliman worked as an IM hospitalist, and then for 4 years as a cardiac ICU physician at Houston Methodist. He completed his cardiology fellowship at Houston Methodist and was then hired as a general invasive cardiologist. Dr. Soliman is now the Associate Medical Director for the cardiology clinics. His interests revolve around efficient preventative cardiovascular care, not just medicinal, but in patient outreach, education, and knowledge. With that, I'd like to thank Dr. Soliman for joining us and welcome him to give his talk on applications of telemedicine in cardiology.
Thank you very much. Please tell me if I am sharing the screen okay?
Yeah.
All right, perfect. Well, welcome everybody. Thank you very much. I would like to thank the Qatar Medical Students Association, Ember Medical, and Dr. Shezli for this invitation to talk about something that's very dear to my heart and something that I'm very passionate about, telemedicine. So just to start out, I have no really financial disclosures per se. We will discuss some devices, and we may bring up different types of devices and so forth. This is not an endorsement to any specific company. We will go over, generally speaking, what is telemedicine, the cardiovascular disease burden around the world, how can digital health or telemedicine be used to modify cardiovascular risk, the tools that you may need to use to actually optimize your telemedicine visits, and subsequently we'll have a quick kind of overview of a few steps to start digitalizing your practice, generally speaking. So people take a look at telemedicine and say, and a lot of people around the world, not just in the US, but a lot of people around the world look at telemedicine and say, what is telemedicine? How this is a very big, different process of practice than I've been used to for the last 10, 15, 20, whatever years that you've been working. Or even in our medical education currently, telemedicine is not really a big part of it. So it becomes very different from a cultural standpoint. And people have different ideas about how telemedicine physicians actually work. And this concept of, well, I'm in front of a camera, I can always wear whatever pants I wear, or so forth, or give different types of reasons why telemedicine does not really, how could that work? So, and then just like I've seen multiple questions on the previous talk by Dr. Soliman about how can I even examine a patient and how does that even work in, to be remote from a patient? This whole practice of medicine revolves around me dealing with a patient, right? Well, just like Dr. Soliman was talking about earlier in our last conversation, it's also a matter of listening to your patient. Sir William Osprey used to say, I had a very good time, you have to listen to your patient to be able, because he's going to tell you the diagnosis, symptoms. If you are able to get a very good history from a patient, a really good history will give you a very clear direction, at least, of what direction you need to go to. So let's talk about digital health. So digital health, generally speaking, means the use of some sort of digital technology to deliver healthcare. Healthcare being it counseling, medicinal management, or so forth, that is personalized to a specific patient. Telemedicine kind of comes underneath that umbrella of digital health. Um, it is done via telecommunication, remotely, obviously, so you're not within the same area of the patient. Like our last presentation, different types include synchronous, which means basically just like this, where there's a video visit face-to-face with the patient, being it in a different hospital, like the telestroke service, or from home. Asynchronous, which is store forward, which if, for example, think of it like, and we're talking about outpatient services. If I'm a cool dermatologist, for example, a patient would send me a couple of pictures of a rash, and I would be able to, and with a couple of questions and so forth, I would be able to diagnose and give that person some treatment. Remote monitoring, it kind of underneath the asynchronous process, but it requires some live physiological data collection, which kind of goes under the umbrella of management of high blood pressure or arrhythmias or physical activity and exercise and so forth. So I think everybody understands that there is a significant increase in cardiovascular disease, not just in the United States, but around the world, that is progressing substantially. There's a lot of different reasons for this, but you could see that ischemic heart disease and stroke is gradually increasing throughout the world. And just like neurologists are not, there are not a lot of neurologists around in regards to neurology per capita. There's not going to be enough physicians, being it internal medicine physicians or being it cardiologists, to be able to provide care for this significant amount of disease burden. So that means that we do need to figure out a way to be more efficient and provide better access of care. This is a slide that I actually really like. This is for a certain patient population, but that'll tell you, if you would be able to take a look, cardiovascular disease, 1 in 2, I'm sorry, of men within that age group has some sort of cardiovascular disease. You take away high blood pressure, and that risk somewhat comes down. This is a certain population, but, and this is, I'm going to bring this back again later on regarding the remote monitoring, but high blood pressure is a major problem. And I will show you how telemedicine can have a major impact on that. So there are modifiable risks for cardiovascular diseases. And what we're going to start talking about is how can digital technologies have some sort of impact on some of these modifiable risks. So for you to have a good telemedicine visit, it's not just the video part. It's not just me seeing a patient, hey, how are you doing? Tell me what you're feeling, etc. You need some tools. And the tools are extremely important for your ability to provide good care to that patient, but also for that patient's satisfaction in regards to their interaction with you. Let me give you a quick example. So I was in med school, and my dad is seeing a cardiologist for management of high blood pressure. And he goes to his physician once every 3 months, every 4 months or so forth. He came back one day, he's pissed. Like, what's wrong, Dad? And so he goes and says, basically, I left work. He's a retired accountant now. I left work, went all the way to the doctor, sat in the room for 15, 20 minutes. They got me in the waiting room. They got me into a room, checked my blood pressure. I waited another 10 minutes for the doctor, and the doctor comes in. He takes a look at my blood pressure, takes a look at my labs, and says, okay, Mr. Soliman, we're going to increase your lisinopril from whatever it was, 10 to 20 milligrams or so forth. I'll see you in 3 months. Bye, see you later. And he's like, I had to leave work, drive through traffic, Houston traffic. I don't know if you guys know Houston traffic. It's not fun. I had to spend all that time, pay my copay for that doctor to come in for 5 minutes, and that's it. So there's an issue on both sides here, right? The physician and their practice is very busy, and he did what he needed to do with the data that he had. He has a blood pressure that's elevated on a patient that has some cardiovascular risk, and he needs to get the blood pressure better controlled. And that's all he needed to do. He reviewed the medication, he reviewed everything that needed to be reviewed. On the patient side, he had to spend half a day for one blood pressure reading in the office for that decision to be made. And then he felt that he spent half a day for something that could have taken 5 minutes. So that's where tools, if you start understanding how to use tools, your telemedicine visit or your virtual visit will become extremely efficient. So like any superhero, we all consider ourselves superheroes in one way or the other, you need some really good tools, right? But if you want to consider tools, you have to kind of figure out what tools are you going to use. They have to be simple. You make a tool or you give a tool to a patient that's complicated, he's going to drop it or she's going to drop it. It has to be consumer friendly or patient friendly. I know we don't like to say the word consumer, but in this process, we have to figure out a way that this tool can be friendly. Reasonable price, and notice I said reasonable, not cheap, because you still get what you pay for, right? Something that would be able to get and collect data the way you need to be, the way you need that data, being it blood pressure, glucose, activity, food tracking. It has to provide a good data collection. Something that's been in the market, and a lot of these have not been in the market for a while, but something that's been in the market for a little bit that has been proven. And then something that you can integrate into your system, being it if you are a private practice, so it's probably an email system or so forth. If you are an institution, into an electronic health record system or so forth. So there's always an app for that, right? So this is what we're going to talk about, is how you can look for devices or applications and how they could be implemented in your day-to-day, and we're talking mostly outpatient, cardiovascular management. So start one, physical inactivity. So, and this is something that I work on a lot with a lot of patients is, well, I walk the dog, I do this, I do that. I think one of the most important aspects of telemedicine, virtual care, and wearables or applications is the patient engagement. And you could go anywhere from somebody that is very motivated to somebody that's not motivated. And you can work with them on using different applications, different processes that, okay, gives you and gives the patient some data. And once you're able to engage the patient, okay, you know what, Mr. Johnson, let's do a couple of blocks a day, record it on your phone. Here's an application, 99 cents at most, worst case scenarios, 99 cents. Most of them are free, or on your watch. And do those 2 blocks, and we'll talk again in a couple of weeks. Once the patient sees and you share this information with the patient, usually you start getting some sort of engagement from the patient. He starts seeing, or the patient starts seeing, I'm doing something. And once they start seeing that data in front of them, you're most probably be able to get them engaged. Smoking. So smoking applications are, and I know that there's going to be a talk later on about mental health and telemedicine. Smoking applications revolve mostly around kind of mental health management, because it is kind of a back and forth reminder, question, answer, and so forth that you can use. That being said, there are a couple of applications that I've used that have been relatively reasonable in regards to assisting smoking. It's not going to be the end all to for a patient to stop smoking, but it is an assisted application. But there's a lot of questionnaires that come back and forth, and a quick reminder here and there with an answer back from the patient. And this data is something that you could prepare for your telemedicine clinic visit. Another risk factor, diet. So you are trying to convince your patients with cardiovascular disease or cardiovascular disease risk factors that they need to stay away from this and try to go to this. It's not easy. All of us struggle with it one way or the other. But again, we're trying to figure out tools to help with that. So what I have used over the last couple of years are different applications for food tracking, applications that can identify good, healthy meals that are on restaurant menus. And the thing is, when you use these food tracking applications and you have your visit next month with your patient and you review the data coming out of that food tracking, it will be most probably you will have a kind of an eye-popping moment with the patient. And they look at it like, wow, I did not imagine that I was eating all that, or I was eating mostly this. And again, it goes back to how do you engage the patient? When you provide a patient some substantial data, you're able to engage the patient on choosing or making better choices in regards to diet. Obviously, telemedicine and virtual care can help with management of general issues like lab work monitoring of lipids and cholesterol and what chronic kidney disease, etc. It goes back a little bit to the dietary part also. But if you are basically managing a patient for high cholesterol and adjusting statin therapy or working with them on diet or so forth, there's no reason for that patient to come into your office. That patient can be taken care of while they're at work in a 5-10 minute telemedicine visit or at home, which engages the patient a little bit more than usual. Now, the second part is the diabetes part. So there has been quite a bit of technological advances with diabetes. And through personal experience, I'll tell you, this has been one of the major advances, the continuous glucose monitoring. So for those of you that don't know the continuous glucose monitor is this small device right here that is placed on the skin subcutaneously, and it sits there for about 10 days or a little bit more according to who you talk to. And it gives you a continuous glucose monitor every 5 minutes. Basically, you don't need to do another finger stick for those 10 days. But what it also gives you an idea of is that when, as an internal medicine physician or an endocrinologist or even a cardiologist, when you are downloading this data during your visit or before your visit with your patient, telemedicine visit, again, there's no reason you're going to examine a diabetic patient that you're managing at that point in regards to glycemic control. You could have a clear discussion with them in regards to their glucose and glycemic control that is associated with an insulin pump that gives them the insulin. So basically you are kind of putting two things together, how much insulin they're taking and how much or how good their glycemic control is. And with that, you could, again, before your visit, this data is downloaded into your system. It takes you a minute and a half just to take a look at it. And you've got a good idea of what's going on with that patient. And you could have a frank discussion with the patient about how good or bad they're controlling their sugars. Now, the next one is something that I am really passionate about and frankly frustrated about. So high blood pressure. So in my opinion, from a cardiovascular standpoint, from a cardiac standpoint, if there's one thing that is or can be controlled via telemedicine and decreases risk substantially, and if that's the only thing that telemedicine does, in my opinion, high blood pressure, because it is clear that we in the United States or around the world are not doing a good job in regards to blood pressure control. Remember that example I was telling you about my dad? He's seeing his physician every 3 months, and gets 1 or 2 blood pressure readings when he comes into the office because his blood pressure has been shooting up after traffic and being frustrated waiting in the waiting room or so forth. Um, so high blood pressure, in my opinion, is one of the simplest, for the most part, simplest things to manage that we are not doing a good job about. So for those of you that know the SPRINT trial, it's a trial a few years ago that compared a blood pressure reading under 140 versus a blood pressure reading under 120. And I will bet you that a vast majority of our patients are not even the 140. But even compared the 140 to the under 120, you could see a substantial decrease from cardiovascular mortality and heart failure just with adjusting the blood pressure. We're not doing a good job on that. And I think that telemedicine will give you a very, very good tool. Telemedicine and virtual care will give you a very good tool in managing blood pressure. So how? So just like Steve Jobs used to say, there's an app for that, right? So there are devices, Bluetooth blood pressure devices, that are as simple as you can get it. You connect it to your phone, you put your arm through the device, you press the word start, it inflates, it deflates, it keeps a record, and makes a graph and makes a full record that goes to your physician. You can't get more simple than that. There are devices like that. There are medication reminders to make sure that the patient is compliant or remembers to take their medications. To be honest with you, some of our patients that are on 3-4 blood pressure medications, it's not easy. I had to take Augmentin twice a day a couple months ago for a sinus infection. I missed 3 doses, and I'm a physician. So you can think about it. You need every single tool that you can use to help your patients. They don't have money to buy, or they don't have the financial resources to buy a Bluetooth blood pressure device. There are tons of blood pressure log applications, a simple blood pressure device that, not Bluetooth, nothing fancy, but there are tons of there are a ton of blood pressure log applications that give you nice reports, nice graphs, and they can be uploaded and sent to you according to whatever platform you use, electronic health record system, or or an email address, or whatever it is that you would like to use in that regards. But again, this is the same company I was telling you about. Put the blood pressure device on your arm, press the word start, and there you go. And there's quite a few of these. It's not like it's one company. There's quite a few of these. And the initial setup, if you're able to do that initial setup where it logs the blood connects to the phone, and then automatically uploads the data to whatever platform, your email or hospital platform or so forth, there you go. So another one of the cardiac conditions that are or should be actually monitored remotely are arrhythmias. And obviously the most common one that everybody comes to mind is the Apple Watch. So I'll tell you, just this year, I've had almost 14 or 15 patients that were diagnosed with atrial fibrillation for the first time on an Apple Watch or on Cardia, which is another company that also provides rhythm evaluation. I've had 3 patients. This is a live core Cardia that came before the Apple Watch and is still active right now. for people that don't have the Apple Watch or don't have some sort of other monitoring that you could use. I've had 4 or 5 patients that were diagnosed with tons of PVCs. One of them eventually diagnosed with sarcoidosis. And this kind of, the PVC kind of tipped us off to start out with. But there are multiple tools that you can use for patients with simple stuff like, I have a lot of palpitations. And they have a device that they own that they can monitor. Patients that have TIAs or strokes or so forth and have some sort of palpitation and you cannot get a loop recorder in them, this is another option to diagnose atrial fibrillation if they have symptoms. We also have patch monitors like this that sit on the chest for, that are patched to the chest for 30 days, up to 30 days, and they monitor 24/7. These provide pieces of data that, again, you can manage remotely. So again, all this goes back to the concept of a telemedicine visit is not just a video visit. It is extremely important to get some symptoms from the patient. If you're able to get symptoms or a questionnaire from the patient prior to the visit and get data, whatever that data may be, if you're looking for rhythm, if you're looking for blood pressure management, if you're looking for symptoms, if you're looking for exercise or activity levels or so forth, all this is part of the whole package of that video visit. And a lot of this data, once it's streamlined, it takes you a minute at most to take a look at, and it's complete data. So like Dr. Soliman was saying earlier, this idea of digitalization or telemedicine, generally speaking, of healthcare, I think is coming one way or the other. And just like other services, being it ride sharing or banking services or so forth, have noticed this over the last decade or two and started working on it early. Unfortunately, the healthcare system, generally speaking, has not. And it has to do with the culture, has to do with the mindset, this idea that how is it that I'm going to manage a patient without actually seeing a patient? How is it that I'm going to manage a patient without listening to a patient? There are a lot of, at least outpatient cardiovascular disease processes that can be done remotely, making your practice, making the patient's satisfaction, time, and resources much, much more efficient. So in my opinion, and I think this has started to become very clear during COVID, that telemedicine is a very, very good platform to deliver good, efficient cardiovascular care. In my opinion also, I think that there is the ability to get better access to better care. So in the United States, we always have this discussion about access. Does this patient have access to care? And I think it's actually a little bit more to that. Does this patient have access to better care? Does this patient have access to a second opinion? In a lot of cases, you can, in second opinion situations where a patient is being managed for blood pressure and coronary disease and so forth, and sends that information to another physician, takes about 10 minutes to review the chart, takes about 10 minutes to have a quick telemedicine visit with that patient, and you could either reassure the patient, yes, that process is the medication, the treatment is a good plan, or not, or other options or so forth. So better care is an extremely important, not just the better access part. Curbside consult, just like Dr. Soliman was talking about earlier, is a very, very helpful tool for many physicians that need some sort of specialty care or specialty idea. Can you take a quick look at this EKG? This EKG kind of worries me. Okay, let me take a quick look at it. Okay, so, you know, and you could kind of get a quick step in rather than hey, Mr. Johnson, you've got a bad abnormal EKG. Let me see if I can set you up with a cardiologist in the next couple of weeks. And right now, in our facility, this was already being built prior to COVID, but it has been pushed a lot faster with COVID, is tele-ICU. And we're using digital and Bluetooth stethoscope devices and so forth to decrease the exposure of our healthcare personnel to patients while being able to still kind of virtually and via telemedicine communicate with them. So let me tell you a couple of important rules for what I believe that digitalization of your healthcare system needs to revolve around. You have to be flexible. You have to be kind of evolve with how things are changing around you. And if better yet, actually be part of that change. As I was telling you earlier, a lot of services have changed over the last decade, and we're going to change too. So either you become part of it as it's changing, or lead it, or frankly, you're going to be late. Because if in the United States, at least, things are changing very quickly, and I believe around the world is going to change very quickly also. This is a very, very important part of your practice. The change of culture. So yes, we are all used to a certain way of managing patients. Patients are used to a certain way of being managed. A lot of patients look at me like, so what do you mean? You're not going to examine me? You have to explain this to patients. You have to kind of ease them into it and explain to them that I don't need to necessarily examine you for chronic coronary disease. If you tell me if you give me some data and tell me your symptoms, I will be able to give you a good answer. You need to understand your patient population, basically the market that's around you, and be able to figure out what processes you need to use to provide care for that patient population. Understanding the available tools and investing resources both are the same thing in my opinion. What basically I mean by this is that download some of these apps yourself. Use them. Get a couple of these Bluetooth blood pressure devices. Use them. Try them out. You will find something that you may like. You'll find something that you may not like. You could find different ways of implementing it in your practice, but you have to physically use them because you're going to be advising the patient to use it. He or she's going to ask you some very, very simple questions about how do I download this, or how do I connect it to my Apple Health application, whatever it may be. If you know this stuff, or if your office knows this stuff, it becomes very, very simple in regards to implementation. And always, as always, the patient always comes first. So while I bring up this issue of this is a consumer-driven process, yes, these are our patients. But in a world where the economy is kind of driving healthcare quite in different directions, if you are able to provide good, efficient care to your patient, you need to do that using every single tool you have. And telemedicine with available tools that are available and will become available is going to be an extremely important part of decreasing the healthcare cost on the patient and on your institution or your practice while providing good care. And I would like to thank you all very much for inviting me, and I'll be available for any questions.
Thank you, Dr. Soliman, so much for such a lovely presentation, great points. So we actually have a couple of questions that came up. So one question was, does remote blood pressure monitoring by the patient at home, for example, does it compromise the quality or reliability of the monitoring?
Does it compromise it? No, it's a very, I think it's actually very good quality. We are building a remote monitoring clinic in which patients are doing exactly that, uploading the data from their applications or from the Bluetooth device reports, and they give it to us. And when we kind of get that report, we take a look at the report. It shows that the blood pressure is improving, not improving, or so forth, and we could do adjustments right then and there. Literally takes about 2 minutes per patient.
Okay. Someone also asked that hypertension and multiple comorbidities are often found in the geriatric population. What if they're not comfortable using the apps that are out there? For example, if a grandfather like has hypertension and it's not comfortable using the phone. Yeah.
So this is the beauty of, I remember that initial part I was saying about tools to be very simple and not complicated. So I'll tell you the vast majority of these, I'm a cardiologist, so you can imagine, I'll tell you most of my patients are above the age of 60, 65. The vast majority of them that are doing telemedicine or blood pressure monitoring or so forth, they love it. But it requires a little bit of an investment on your end and on the front end. If you're downloading, in the clinic, I would download the app on their phone. Show me your phone. I'll download the app for you. Here it is, and here's how you put in the information. And it becomes very simple. If they're coming in, I tell them bring in your home blood pressure machine with you, and A, to make sure that it's accurate. B, to show you how to upload that information. Worst case scenario, if a patient really does not know how to use a phone, and I'll tell you, the vast majority of a lot of older patients do know how to use a phone, but worst case scenario, they don't know how to use a phone. These Bluetooth blood pressure devices, you just put your arm, you press the word start, and it automatically sends a blood pressure log once a week.
Mm-hmm. Some describe telemedicine as a luxury of the developed countries. How do you think it can be incorporated into developing countries who have the majority of the population as being poor?
So I'm originally from Egypt, and I actually went to med excuse me, after high school, I actually went to Egypt for med school. So I kind of know a little bit about the healthcare system in Egypt, or Alexandria for the most part. Just about every person, or relatively just about every person, has some sort of smartphone. The internet connections in Egypt, at least, are relatively underdeveloped and has a lot more room for improvement, yes. But there are a lot of communications via WhatsApp. There's a lot of growing telemedicine programs that are developing in, at least in Egypt that I know of, and in the Middle East, generally speaking. To me, it's not necessarily a resource or a financial issue, because a patient that needs to go to the doctor still figures out a way to go to a doctor one way or the other. I think, again, when we go back to that better access, good access, or better access of care, you are able to get that person that type of care. The issue goes back to how. And it's a culture change. A lot of people would say, how is it that I'm going to see a doctor by phone? By video, that's it? So that's one part of it. The other part of it is digitalizing the infrastructure. So for us in the States, when you do a visit by video, it's an automatic payment through the system. There's already, whatever credit card payment payment process or so forth that works. So the compensation process also needs to be kind of digitalized, if you may.
And on the note of digitalization, do you think that there's a way to ensure that the digital values are not manipulated?
That the digital values?
That come from the applications or the technologies that are used.
So if I understand your question, you're talking about security. And that's obviously a very important question, because anything and everything can be hacked at any time. yes, that is a big problem that is being managed in one way or the other. There's a lot of different applications that have different encryptions to help with that. But to be honest with you, I've been doing this for 3-ish years now. I've never had a concern in that regards, specifically in regards to basic information of blood pressure or lipid or physical activity or so forth. Somebody sharing what type of activity they're doing or so forth. The other thing is, if you think about it, I still review this information with the patient via telemedicine, right? So I'm getting blood pressure log it once every week, but I meet the patient once a month online. And, hey, Mr. Johnson, your blood pressure has been up the roof. What's going on? Like, what are you talking about? My blood pressure has been fine, but what I sent you was normal. So there's a discrepancy. So you kind of have to, again, this is part of the overall package of your telemedicine visit with all that data to work with. But in regards to security, yes, a lot of people have that type of concern in regards to security. But in regards to remote monitoring with data of blood pressure, heart rate, physical activity, and so forth, I don't think that's what is going to be hacked. What is attempting to be hacked, or the information that is being of concern, would be name, date of birth, stuff like that.
All right. Thank you so much, Dr. Soliman.